In Canada, we have a universal healthcare system. So that means that everyone has access to physicians, to hospitals and nurses, no matter where they live, no matter what their bank account is. The difference, the contrast, south of the border, is that there are tens of millions of people who do not have access to healthcare. This plays out in very serious and vicious ways for people who end up living on average 4 years less in the United States than in Canada, and with much higher costs and healthcare costs and worse health outcomes because people are denied access to health insurance and healthcare when they need it. The other part that you have to say is a major difference in working between two systems is the amount of administrative burden, the amount of challenges for patients or people who lose health insurance between jobs, and that it cuts away at what we've been trained to do, which is to see patients when they need it most and provide the best possible care. When it comes to cancer care, it's probably the most stark example of the differences between receiving care in Canada and the United States.
Cost of cancer, which touches just about everyone. Drug prices driving patients and their families into bankruptcy.
With cancer, there are a number of different cancer centers and hospitals in Canada, many of them that are internationally recognized. The cost of what it would look like to go through cancer care is not part of the equation. The stark and different reality in the United States is that for people who are receiving a cancer diagnosis, there is a number of different considerations that come into place. We know that for far too many, it's a reality of whether requiring medical debt, going into foreclosures, losing your home, being in some real serious financial crisis when it's already feeling like a health crisis.
There's no way I could come up with that kind of money. I mean, I'm sitting here with a treatment that could give me years, right in my grasp. And I couldn't have it.
That is not a reality in Canada. People do not go into medical debt. Let's do a really simple comparison. Right now, even with universal health coverage, the Canadian system costs less per capita, per person, than it does the United States. So for those who wonder, can a country like America afford universal health coverage? My question back would be, how much longer can you afford the status quo?